Okay, thank you very much for the invitation to speak today. Okay, so female reproductive disorders account for about 40% of human infertility cases, and we need animal models to be able to investigate the complex pathophysiology of these disorders, although many of the molecular aspects of these disorders are unknown, animal models have proven a very powerful tool in finding out new things about these disorders. Okay, so the definition of an animal model is a living organism with an inherited, naturally acquired or induced pathological process that in one or more respects resembles the same phenomenon in man. And some of the common animal models used for study of women's reproductive health include rodents, so mice and rats, monkeys and surprisingly sheep. So why would you want to use animal models to study female reproductive disorders? So it's very difficult to study the initiation, progression and treatment of disease in humans, and data generated with biopsied material from women is often only descriptive. So to be able to understand some of the mechanisms in these pathologies, we need to use animals, and animal data can provide us with models of biological trends before proceeding to human application. So computer models and cell cultures can provide only a limited amount of information, but final tests have to be done in whole living systems. Even the most sophisticated technology cannot mimic interactions among cells, tissues and organs that occur in humans and in animals. And also for ethical reasons, drugs or procedures need to be explored in whole biological systems before being used on humans. So the categories of animal models fall into 4 groups. So induced or experimental models include, for example, induced endometriosis in rodents. Spontaneous or natural models include spontaneously developing endometriosis in non-human primates or spontaneous menstruation in the spiny mouse. There are also some not so common models, including negative or non-reactive models, which are a normal counterpart of a disease model, useful for studying why disease does not occur. And then orphan models, so these are animal models of diseases for which no human counterparts are known. And these have actually given us some surprising insights into human disease. So for example, the Rous sarcoma virus in chickens, which has revolutionised the way we think about cancer. So there are many different considerations that you need to bear in mind when selecting a species as an animal model. These include the availability of lab facilities, presence of a breeding colony, the cost, ease of handling and housing, the relatedness to humans, and also the availability of transgenics if you want to go down the genetic route. So there are many differences and similarities within species that you need to think about when selecting your animal model. So mice are often chosen because of their tractability, but there are lots of important differences. For example, in the study of parturition, so mice have multiple pregnancies, a short gestation length. They also have a bicornuate uterus, and progesterone is produced primarily by the ovary throughout gestation, whereas in humans there's a luteal placental shift later on in gestation. There's also many similarities. So for example, sheep are often used to model polycystic ovary syndrome or ovarian function. And this is because their developmental trajectory is very similar to humans, and follicular development, much like monkeys and humans, occurs prior to birth, where it occurs postnatally in mice. The ontology of other organs is also very similar to humans, such as the hypothalamus and the pancreas. They also either have singleton or twin pregnancies, like humans. And many of the factors that control ovarian function are very similar to humans as well. So for other disorders, there has to be a bit of a trade-off as well. So for example, for modelling menstruation and endometriosis, we know that most mice don't menstruate, and this is a precursor for the development of endometriosis. So non-human primates are the most physiologically relevant model to study these processes and disorders, but they also come with considerations of cost and ethics. So we have to try and model these disorders and processes in more cost-effective ways, so using rodents. So a number of non-human primate models for the study of endometriosis have been used. You can see these. So primarily, to begin with, endometriosis was modelled in rhesus monkeys, and now the preferable model is the baboon, because we know that baboons spontaneously develop endometriosis. And these lesions also look very similar to lesions recovered from human patients. Some of the changes that take place in the ectopic endometrium, well, most of the changes that take place in the ectopic endometrium are very similar to the human as well. So this table is just showing the similarities when the baboon ectopic endometrium and ectopic endometrium is compared to the human, and a lot of the same factors are implicated in the different stages of lesion, attachment and progression. Non-human primates are also very costly, and there's other considerations to take in to bear in mind, like this speciality, housing, and handling, and the ethics surrounding research with non-human primates are also difficult to navigate. So taking that into consideration, when we design studies using animals, we have to think about the 3 R's. So these are replacement, reduction and refinement. So replacement involves methods which avoid or replace the use of animals. So this includes using human volunteers, or cells and tissues recovered from humans, mathematical or computerized modelling systems, and cell lines extracted from animals. Reduction, which involves methods which minimise the number of animals used per experiment. So we need to really think about and optimise our experimental design and statistical analysis. And refinement, so methods which minimise suffering and improve animal welfare. This includes using appropriate anaesthetics and analgesics, as well as enrichment material for rodents, for example, so that they can exhibit their species-specific behaviour. Okay, so for the rest of the talk, I'm going to focus on rodent models of menstruation and endometriosis. So this is my particular area of expertise. Okay, so menses is the shedding of the upper functional layer of the endometrium, and this is the culmination of irreversible changes in tissue function, including stromal decidualization, inflammation, and production of degradative enzymes. So in women, very specific changes take place in the tissue architecture during menstruation, and we can study these by looking at endometrial biopsies taken from women undergoing gynecological procedures. So this allows us to produce descriptive data, but to be able to explore some of the mechanisms involved in the process of menstruation, we really need to model this. So in Edinburgh, we used a modified mouse model of menses. So this was implemented into the Saunders laboratory by Fiona Cousins during her PhD, and the method is a modified protocol which has been modified from the original Finn and Pope and Brasted protocols. So to model menses in mice, we ovex mice to remove any endogenous hormones. They're then allowed to recover, and we inject estrogen on 3 consecutive days, and then we give the mice a 3-day break, and they're then given a P4 or progesterone implant and further estradiol injections at a lower concentration. So this is 5 nanograms. We then induce progesterone withdrawal on day 19, and then Fiona collected tissue from the mice at several different time points. So we developed this protocol to mirror the human menstrual cycle. So we have a proliferative phase, secretory phase, and then a menstrual phase. From between 4 and 12 hours, we can actually see overt bleeding from the mice. And when we remove the uterus, you can clearly see the decidualized uterine horn compared to the non-decidualized horn. Sorry, I forgot to mention that we also give the mice a decidualization stimulus. So in humans, decidualization occurs spontaneously, whereas in mice this only occurs when there's a presence of a blastocyst. So we have to mimic this, and to do this we inject oil into the uterus, and this is actually done non-surgically. So we use a non-surgical embryo transfer device to insert oil into the uterus through the cervix. And what Fiona was able to show was that there was a rapid decrease in progesterone concentrations when we removed the P4 pellet, and that mice exhibited bleeding between 4 and 24 hours. Okay, so Fiona then went on to investigate some of the mechanisms that were responsible in restoring uterine tissue integrity after menstruation. So these images show a cross-section of the uterine horns, and Fiona was interested in seeing how the epithelial cells actually contributed to re-epithelialization of the denuded surface once the decidualized mass was actually shed from the basal layer of the endometrium. And she used BRDU staining and also staining for cytokeratin, which is an epithelial cell marker. And she was able to show that the epithelial cells proliferated, but we also saw evidence of migration as well. So you can see here that the epithelial cells actually look like they're rolling over each other to cover the denuded endometrial surface. And using staining for cytokeratin, which I mentioned stains the epithelial cells, and vimentin, which stains stromal cells, Fiona was able to show that some of the stromal cells actually expressed cytokeratin. So we thought that these could be going through mesenchymal to epithelial transition. And using dual immunofluorescence, so the cytokeratin is in green and vimentin is in red, some of the cells exhibited staining for both cytokeratin and vimentin. And Fiona also looked at a number of mRNAs that encoded genes involved in mesenchymal to epithelial transition, and these showed remarkable changes throughout the breakdown and repair phases of menses in the mice. Okay, in another study in the Saunders lab, Fiona was also able to show that androgens play an important role in regulating the repair of endometrium following the shedding of the decidual mass. So the mice, at the initiation of tissue breakdown, were given an injection of DHT, which is a non-aromatizable androgen. And they found that this actually increased the duration of bleeding in mice. So this was the original graph shown in the previous slide, and when the mice were given DHT, the mice bled for longer, and and they were also able to show that androgens delayed the restoration of the re-epithelialization, and by weighing the uterine horns, they could show that it took longer for the endometrial tissue to actually be shed. Okay, so they also looked at a whole range of genes associated with tissue remodeling, cell adhesion, and cell matrix, and these were reduced by treatment with DHT, indicating that androgens play an important role in regulating the restoration of the endometrium. So in another recent study, looking at monocyte and macrophage dynamics during endometrial breakdown and repair, Saunders group have been able to show some really interesting findings where different immune cell populations associate with different areas of breakdown and repair. So they're seeing an influx of monocytes. Sorry, this was all produced using the mat-green mice. So these mice have macrophages labelled with green fluorescent protein. And this is dual immunofluorescence for GFP. So this is marking any of the cells that express the CSF1 receptor. And the red is F480, which is a marker of activated macrophages. And in areas of denuded epithelium, they were able to show that GFP positive monocytes were present, and some of these cells didn't express GFP, they're only expressing F480. So these are thought to be a tissue resident population of macrophages. And using flow cytometry, they were able to show that in the stimulated horn, so this is the decidualized horn, there's a huge influx of these GFP positive monocytes and an influx of monocyte-derived macrophages as well. So during this study, they were able to come up with a schematic where they have an influx of monocytes at areas of active repair. These monocytes can go on to acquire the expression of F480 and differentiate into tissue-resident macrophages, and monocytes either die or then go on to differentiate. Okay, so there's also a new potential model of menstruation, the spiny mouse, which has recently been shown to exhibit spontaneous decidualization and shedding of the endometrium. But many studies are required to investigate the role that this may have in endometriosis, for example. I'm going to focus on endometriosis now. So we know that endometriosis is a very complex disorder, and the presence of endometriosis lesions within the peritoneal cavity have really important impacts on different systems within women that have endometriosis. So for example, the presence of lesions can impact on the reproductive system, causing infertility, and they may also impact on the nervous system, because we know that endometriosis lesions develop innervation, so they establish a dialogue with the central nervous system. And because there's no diagnosis for endometriosis currently, women have to undergo laparoscopy, and this allows the biopsy of material so that we can perform important ex vivo studies to generate descriptive data. So these images are showing the establishment of stromal and epithelial compartments within the lesions using cytokeratin and stromal staining. And these images are dual immunofluorescence showing a pan-neuronal marker, PGP 9.5 in green, and CD31, which is a marker of endothelial cells, in red. So we're seeing a coordinated growth of blood vessels and nerve fibres, and this staining here is showing nerve fibres, and the red staining is CD68, so a marker of macrophages, showing that these nerve fibres and macrophages are in close association. And this could be indicative of neuroinflammatory interactions taking place within endometriosis lesions. So we can use ex vivo material as well as in vitro cells to be able to look at different mechanistic components of endometriosis, but ultimately we need to be able to model endometriosis in vivo using model systems. So in Edinburgh, to try and address the 3 R's, we try to use an integration of different models. So models of endometriosis initially started in the rat. So the initial rat model of endometriosis, published by Vernon and Wilson, sutured whole uterine fragments onto the peritoneal lining. And this was modified by Karen Berkeley, and they actually sutured uterine fragments to different areas within the peritoneal cavity, including the ovary, the lower abdominal wall, and the mesenteric arteries supplying the small intestine. And this model is being used to demonstrate many key findings in the field, including vaginal hyperalgesia, innervation of lesions, as well as estrous changes in vaginal nociception, innervation, vascularization, and growth factor content. And they were also able to show endometriosis-dependent changes in visceral and cardiovascular responses. So just recently, there's been another rat model of endometriosis that's been developed, and this is an alternative model. So ectopic uterine material is actually sutured onto the gastrocnemius muscle. So sorry, this image is showing the new model where material is sutured onto the gastrocnemius muscle juxtaposed to the Berkeley model. And this model of ectopic endometrium is a chronic pain generator. Actually allows the measurement of hyperalgesia directly around the ectopic uterine tissue using digital force transducers and single fibre electrophysiology. It also allows intralesional injections and labelling of the dorsal root ganglion neurons that innervate the ectopic uterine tissue, and easy extraction of the DRGs for cell culture. So this has also been used, this model has also been used in other studies to screen pro-nociceptive molecules and explore the role of GPR30 in endometriosis-associated pain. So following on from the rat models of endometriosis, mice became more common for modelling the disorder because they're smaller, cheaper, and also there's many different transgenics available. So there are many mouse models of endometriosis published in the literature, and they fall into 3 main categories. This includes the autologous model, where one uterine horn from the mouse is ligated and removed, fragmented, and then sutured back onto the lining of the same mouse or injected into the peritoneum. The heterologous model, where human endometrial tissue is xenografted, usually subcutaneously, into immune-deficient mice. And the syngenic model, in this model, donor mice are used for endometrial tissue, and this is sutured onto the peritoneal lining of recipient mice or injected into the peritoneal cavity. And in Edinburgh, it's this syngenic model that we've adapted for our studies. So the Edinburgh mouse model of endometriosis is different because we use what we're calling donor mouse menstrual tissue. So I already showed you the timeline for our mouse model of menses. So the donor mice are actually induced to go through this menstrual-like event. And we collect the decidualized material and resuspend this and inject it into the peritoneal cavity of recipient mice. And we leave the mice for 3 weeks, and during this period they develop endometriosis lesions. And here are some examples of the lesions that we can collect. And on histological examination, they look very much like human lesions. So they have well-established stromal and epithelial compartments, as well as evidence of hemorrhage and hemosiderin, indicative of immune cell influx. We also find that the mouse lesions are highly vascularized and innervated. So this is a dual immunofluorescence for PGP 9.5 and CD31. And we can quantify innervation and vascularization of lesions. So we find that there are significantly lower numbers of nerve bundles in endometriosis lesions compared to the peritoneum, whereas there are significantly more small diameter nerve fibres that are typical of sensory innervation present in lesions compared to the peritoneum. The lesions are also highly vascularized, so this is significant compared to the peritoneum. So using the syngenic model, we can actually use genetic manipulation for the analysis of donor or recipient contributions to endometriosis lesions. So I showed data before where Fiona used the Matt Green mice, and we also used this in the endometriosis model as well and performed reciprocal transfers of donor material into recipients. So we used Matt Green donor material into wild-type recipients and wild-type material into Matt Green recipients. So this is a section of a donor uterus before we actually scrape out the material and inject it into the peritoneal cavity. And we find many macrophages present within the decidualized mass. And when we perform wild-type transfers of wild-type endometrium into Matt Green recipients, we find many GFP-positive macrophages within the lesions. And in the opposite experiment using Matt Green recipients into wild-type donors, we also find macrophages present within the lesions, indicating that macrophages present in this shed endometrium contribute to endometriosis lesions. We quantified this, and we actually found that more of the macrophages are actually coming from the recipient, indicating that these could be elicited macrophages that are either from the peritoneal environment or extravasating from the bloodstream into endometriosis lesions. I already showed this image earlier on, showing that macrophages and nerve fibres are in close association in lesions, indicating the potential for neuroinflammatory interactions. And the work that I do actually focuses on macrophages and how they might be involved in promoting nerve ingrowth into lesions and activation of the nerve fibres. And using the mouse model of endometriosis, we looked at estrogen receptor expression of macrophages within lesions. Again, this is using the Matt Green mouse, so we're using GFP as a marker of macrophages. We found that there were more macrophages in lesions compared to the peritoneum, and when we stained for estrogen receptors, all of the macrophages expressed ER beta, whereas only a proportion of them expressed ER alpha. We were also able to show that estradiol was very important in regulating the influx of macrophages into lesions. So after lesion establishment, we divided the mice into two different groups that were exposed to a vehicle or estradiol, and the lesions collected from mice exposed to estradiol had many more macrophages present within them. And we also went on to use some specific macrophage and neuronal cell cultures to look at the specific mechanistic interactions between macrophages and nerve fibres before we went back into the mouse model. And we found that macrophages in response to estradiol were producing neurotrophins, and the nerve fibres, when activated with estradiol, were producing important factors required for macrophages for survival and migration, as well as activation. But in the mouse model, some of these key factors that we identified were also significantly upregulated in the endometriosis lesions. So we saw an increase in CSF1, which is very important for macrophage survival, neurotrophin 3, and we found that this was produced by the macrophages in response to estradiol, and TRAC-B, which is a neurotrophin receptor specific for neurotrophin 3 and brain-derived neurotrophic factor. And we also found that these factors were regulated by estradiol in the endometriosis lesions. So we came up with this schematic where locally acting estradiols stimulate nerve fibres, and they increase the expression of CSF1 and CCL2, which is an important chemokine for macrophages. This enhances macrophage migration into lesions, and estradiols acting on macrophages cause an increase in brain-derived neurotrophic factor and an increase in neurotrophin 3, which promotes neurogenesis. So we think that these cellular interactions might be important in the generation of pain in endometriosis. So following on from these studies in the lesion microenvironment, we wanted to see whether the mice were actually exhibiting changes in pain behaviour. So we used a number of different behavioural tests in the mice. So we looked at spontaneous behaviours, which included abdominally directed grooming, as well as activity, which is a modification of an open field test. So the mice in their home cage have a tunnel present, and we can record the number of times the mice go in and out of the tunnel, which is in the centre of the cage. And we also use evoked behavioural tests, and these are von Frey filament touch test. And for those of you that don't know, this is quantitative sensory testing. So these filaments that are supplied have different weights. So they start off as very fine filaments and gradually get stronger. So we can apply these filaments either to the abdomen or the hind paw of mice, and we record the filament, which produces a withdrawal response 50% of the time. So what we were able to show was that mice with endometriosis exhibited significantly higher levels of abdominally directed grooming. I'll just explain these groups to begin with. So we have 3 different control groups. These include naive mice that have had no procedures done on them, mice that have been ovexed and then given estradiol, mice that are ovexed, given estradiol and a PBS injection into the peritoneal cavity to mirror the introduction of endometrial tissue, and then our mice that actually have the endometrial tissue injected into the peritoneal cavity. We also found that mice with endometriosis had significantly decreased levels of activity, and using the von Frey filaments on the abdomen and the hind paw, we found that mice with endometriosis had significantly decreased withdrawal thresholds when the filaments were applied to the abdomen or the hind paw, indicating that they have both local and secondary hyperalgesia. Okay, so we were interested to find out what mechanisms could be responsible for the changes in sensory behaviour. And we know that our material that's injected into the peritoneal cavity, our menstrual material, is highly inflamed, so there's increased levels of cytokines and prostaglandin E2. And we know that prostaglandin E2 is important in the generation of pain in other inflammatory pain conditions. So we wanted to investigate this as a factor that might be responsible for endometriosis-associated pain. So when we look at the lesions collected from mice, we found that the prostaglandin E2 receptors EP2 and EP4 were significantly increased in endometriosis lesions, as were COX-1 and COX-2, the enzymes responsible for prostaglandin synthesis. And we could show this using immunohistochemistry as well. And we also found increased levels of prostaglandin E2 in the peritoneal fluid of mice that have endometriosis. Okay, so we were able to show that mice with endometriosis had secondary hyperalgesia. So this is indicative of a central component to their pain. So we hypothesised that there may be changes in the central nervous system that could be causing this secondary hyperalgesia. And to explore this, we looked at the dorsal root ganglia of mice with endometriosis. So this is where the cell nuclei of the nerves that innervate endometriosis lesions are. And we found that the EP2 receptor and COX-1 were upregulated in the dorsal root ganglia of mice with endometriosis, as were two nociceptive genes, so SCN11A, which is a voltage-gated sodium channel, and TRPV1, which is the capsaicin receptor. And both of these are important in nociceptive pain, and they were both upregulated in the DRGs. Oops. Okay. And we then went on to look at the protein expression of TRPV1 in the DRGs of mice with endometriosis. So this dual immunofluorescence is showing TRPV1 in red and peripherin in green. So peripherin marks the small diameter, the nuclei of the small diameter nerve fibres. And we found that significantly more of these peripherin positive DRGs were expressing TRPV1 in our mice with endometriosis, and this was quantifiable and statistically significant. We then went on to look at the spinal cord and the brain of mice with endometriosis, and we looked at COX-2 expression, and this has previously been shown to be upregulated in the CNS of in other inflammatory disorders, inflammatory pain disorders. And we found that COX-2 was upregulated in the spinal cord, the thalamus, and the anterior cingulate cortex, which is an area of the brain important in pain processing. So we think for the first time we've been able to show that mice with endometriosis actually have a central component to their pain, because we can actually show molecular alterations in the central nervous system. And because we were able to show this, we thought that our mouse model of endometriosis was a good preclinical platform for testing potential therapeutics. So we went on to test different antagonists in the model to see if we could rescue the altered sensory behaviour. So initially we used a TRPV1 antagonist. So these graphs are just showing the point where we saw maximum reversal. And this is intraperitoneal injection of the different compounds. And we found that TRPV1 did not rescue the pain state when von Frey filaments were applied to either the abdomen or the hind paw. We then went on to use an EP4 antagonist, and again this had no significant effect in altering the pain state in mice with endometriosis. Next we used an EP2 antagonist, and this time we saw a significant attenuation of the pain state. So, sorry, I've not explained these groups very well. So we've got naive mice that were given the compounds, endometriosis mice with the vehicle, so these animals should have the lowest withdrawal thresholds, and then endometriosis mice that were given the compounds. So we could rescue this when filaments were applied to the abdomen, but it wasn't statistically significant when we applied filaments to the hind paw. We did, when we researched this compound in a bit more detail, find that it wasn't the most specific EP2 antagonist. So we went on to try a more specific EP2 antagonist that had over 4,000 selectivity for the EP2 receptor. And we found that this compound significantly rescued the pain state when filaments were applied to the abdomen and also to the hind paw. And to investigate the translation of this compound in a bit more detail, we administered it orally to the mice because the other results were generated using intraperitoneal injections. And we saw that this had very significant effects on abdominal pain and secondary pain. Okay, so that's the end of our endometriosis model data, but I just wanted to show this slide because many of the mouse models of endometriosis are not applicable for studying fertility because they use mice that are over-ectomized, so they can't sustain pregnancies. But there are models out there that use intact mice and allow the investigation of fertility. So this is just a slide. It's from a study published by Gabriela Maresman's group, where they were able to show that the presence of endometriosis had a specific effect on decrease in pregnancy. Okay, so just to summarise, laboratory models available for reproductive health research are improving. They all have their benefits and advantages, and models used are dependent on your research questions, so careful selection of the most relevant and responsible model is required. There are many considerations, including ethics, cost, your hypothesis, and also your desired endpoints. And they have more power when combined with in vitro studies and also referred back to human material to show validation of findings generated in animal models. So I just want to acknowledge the other members of EXPECT, Andrew Horn and Philippa, and the majority of the studies that I showed in this talk were generated in Philippa's group by Fiona or me when I was doing my postdoctoral training with Philippa, and our funding bodies. Thanks. Any questions?